taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenore and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the Wellness Watch. I'm your moderator, George Strait. We take pride in the Wellness Watch on bringing you the latest information on how to stay well in the face of myriad diseases out there and racial discrimination that threatens our very being. Well, today we introduce you to an ailment that's not as familiar. It's called peripheral artery disease, and highlight a partnership that we have with an organization called the 100 Black Men that is raising awareness about this condition. To help us sort through all of this is Dr. Richard Brown. He's a noted cardiologist and senior medical executive and leader of the Cardiovascular Health Equity Advisory Council, that's a mouthful, Johnson & Johnson. He's also a fellow graduate of Boston University. Dr. Brown, welcome.
Thank you so much for having me, George.
And leading our conversation, of course, is our host, Dr. Mike Lenore. Mike?
Dr. Brown, I've been practicing medicine for a very long time, and I thought I was familiar with most conditions. But I must admit, I was caught off guard and did not understand the tremendous role that peripheral artery disease plays, especially in the African American community. Tell us what it is.
Peripheral artery disease, or otherwise known as PAD, is a often undertreated, underdiagnosed medical entity. As a matter of fact, up to 12 million Americans have PAD, and many of them are not aware of it. So what is peripheral artery disease? It is blockages that have developed in the blood vessels going to your arms or your legs. So it's the peripheral arteries that develop a condition, a cardiovascular condition, where the blood supply to your arms or your legs is compromised. You might say, well, is that really important? It is, because we know that peripheral artery disease significantly increases your chances of having a stroke. It also raises your risk of having a heart attack substantially. It increases your chances of having a leg amputation, and it also significantly increases your chances of dying from a cardiovascular cause. So despite the fact that many people aren't aware of what peripheral artery disease is, it is one of the most deadly cardiovascular conditions that a patient can encounter.
Tell us, Dr. Brown, how does it present? What are some of the clinical manifestations, both subtle and direct?
Yeah, so if you look at a typical patient who presents with peripheral artery disease and a reduction in the blood supply to their legs, they often present complaining of what we call claudication.
Dr. Brown, what are the symptoms of peripheral artery disease, and are they subtle?
Is that every time you walk, you develop pain in the back of your legs around your calf muscles. The pain comes on as you walk, and it goes away whenever you stop whatever activity you were doing. This is an important symptom because often what patients do is they stop what they're doing, the pain goes away, and they carry on with their normal life. And they don't recognize that it might represent cardiovascular disease and have it checked out. So that's the most classic symptom, claudication. But there are other symptoms that you can have. For instance, a patient could notice that there is discoloration of the skin around their shin. They can notice a loss of hair on their lower leg. They can also notice that at night, while laying in bed, their feet or their lower leg hurts, just a pain while they're doing nothing. Having an ulcer on your foot that is not healing can be indicative of PAD because of reduced blood flow allowing that ulcer to heal. The most worrisome thing about peripheral artery disease, or PAD, is that 40% of patients are asymptomatic. So they could have significant PAD, but yet don't have any of the symptoms that I just described.
So, Dr. Brown, the pain that's associated with peripheral artery disease may mimic a slight muscular pain, making it difficult to diagnose. Is that correct?
Yeah, so very often when folks with peripheral artery disease first having those symptoms in their legs when they exercise, they might think that it's a pulled muscle or some musculoskeletal problem. The other thing that we have come to recognize is diabetics. They often feel, I'm having a funny sensation in my legs. I'm having a numbness. So that's another sign or symptom that I didn't mention. Numbness or paresthesias can develop in the legs. And sometimes diabetics feel, hey, that's part of my diabetic disease. It's a neuropathy. But that often is actually a sign of peripheral artery disease, which is why it's important for everyone to recognize what are the risk factors, what are the things that increase the likelihood of you developing PAD.
So, Dr. Brown, what are those risk factors?
We know that smoking substantially increases your chances of developing blockages in the arteries to your legs. As a matter of fact, smoking quadruples your chances of developing peripheral artery disease. Having diabetes, high sugar levels, is a significant irritant to that inner lining of the artery and promotes plaque formation. If you look at diabetics in the United States, if you are over the age of 50 and you have diabetes, your chances of having peripheral artery disease is 1 in 3. High blood pressure. You can imagine someone's blood pressure being elevated, constantly that high pressure pounding against that inner lining of the artery. That's a total setup for plaque and deposits forming on the inner lining of that blood vessel. We also know that individuals with chronic kidney disease, so their kidney function has declined from normal. As your kidney function goes down, the chances of you developing blockages in the blood vessels to your leg goes up. Getting older is also a risk factor. So as you advance in age, your chances of developing these blockages in these blood vessels also go up.
There is a test for PAD, as explained by these experts from the Mayo Clinic.
Diagnosing peripheral artery disease starts by checking circulation to the feet.
Taking off the shoes and socks, doing a foot exam, feeling the pulses.
An ankle brachial index test can identify circulation issues by comparing blood pressure in a person's ankle to that in their arm before and after exercise.
In fact, Johnson & Johnson has developed a mobile van that goes to various underserved communities to test for PAD. The test is non-invasive, and it's called ABI.
We have 2 mobile units that go across the country, and we offer ABI testing for free. And we have gone to multiple communities. We've gone to Philadelphia, Atlanta, Houston, New Orleans, Los Angeles, just to name a few of metropolitan areas with lots of Black residents. And we have done ABI testing in these communities. And we have found a very high rate of abnormal ABIs. As a matter of fact, back in April of last year, when we were in Houston, our ABI positivity rate was 41%. The national average is 14%. So an ABI rate that high indicates to us that there are communities of Black individuals in which they are living with PAD, reduced blood flow to their legs, and they are absolutely not aware of it. Why is that a problem? Because these are the same people that now show up in the emergency room at 2 o'clock in the morning with a threatened limb, and they end up in an operating table getting their legs amputated. So part of the reason that we believe that ABI testing is so critical is because we know that the earlier you can detect PAD, the earlier you can put someone on a walking program to help with the disease, the earlier you can put the patient on appropriate medical therapy, with the hope that earlier detection leads to earlier treatment, which then decreases the chances of that patient having a PAD-related amputation.
PAD, peripheral artery disease. As Dr. Lenore said at the opening, who knew? Dr. Brown is part of a program to call attention to PAD called Save Legs, Save Lives. On its website, you can find out more about PAD, where the mobile testing van will be, and also view this helpful video.
If you're cramping, tingling, or have weakness in your legs, it could be that you're suffering from peripheral artery disease, or PAD. It's estimated that PAD affects up to 12 million Americans, and African Americans are more than twice as likely to be impacted by PAD. Many people with peripheral artery disease have mild or no symptoms. However, some do experience leg pains while walking or exercising. PAD can lead to leg or foot amputation, and it may increase the risk of a heart attack or stroke. That's why early detection is key. Decrease your risk of PAD and know your personal risk factors. Many of them can be avoided or managed, such as diabetes, chronic kidney disease, obesity, high blood pressure, high cholesterol, and nicotine use. If you have pain in your legs or feet, please get screened for PAD. At your next medical checkup, remove your shoes and socks and ask your doctor to examine your feet and feel for your pulses. It could save your life and limbs.
Again, thanks to Dr. Brown and Dr. Lenore, and thank you for watching this edition of the African American Wellness Watch.